Hello students, I am Dr. Gayathri, Assistant Professor at Smriti College of Pharmaceutical Education, Indore, from the Department of Pharmacology. In our series on antihypertensive drugs, today we will look at the other two classes of sympathetic inhibitors, that are beta plus alpha adrenergic blockers and alpha adrenergic blockers. Beta plus alpha adrenergic blockers, we will look at this class of drugs by taking labetalol as an example. So labetalol, from the name itself, we can understand that they show both beta and alpha adrenergic blocking actions. So labetalol non-selectively antagonizes beta adrenergic receptor and selectively antagonizes alpha-1 adrenergic receptor. So when coming to beta receptors, it non-selectively antagonizes, that is both beta-1 and beta-2 it antagonizes. And while coming to alpha receptors, it selectively blocks only alpha-1 adrenergic receptor. So it displays beta-1 plus beta-2 plus alpha-1 blocking actions as well as weak beta-2 agonistic activity. In our previous class, we have seen where beta-1 and beta-2 receptors are located, what happens when they are stimulated and what happens when they are blocked. So coming to the mechanism of action, it acts by reducing total peripheral resistance and its action is faster than pure beta blockers. So when beta blockers alone are used and when beta plus alpha adrenergic blockers are used, the time taken for action is greater in beta plus alpha adrenergic blockers compared to beta blockers alone. So it has been used IV intravenously for rapid BP reduction. So in patients such as patients who are in hyperadrenergic states, in cheese reaction and clonidine withdrawal or eclampsia, etc. So in these conditions, beta plus alpha adrenergic blockers, that is labetalol, is taken intravenously to rapidly reduce the blood pressure, because we have seen that it acts faster than beta blockers given alone. So coming to oral therapy, when given orally, it is given orally only in moderately severe hypertensions where the patient is not responding to beta blocker. So for the patient, if in moderately severe cases, if the patient is given beta blockers and the patient is not responding to them, in such cases labetalol will be given, as it shows side effects of both alpha plus beta blockers. Why it is used only in severe cases, when patients are not responding to beta blockers, is because just the way it shows both alpha and beta adrenergic blocking action, it also shows both alpha and beta blocker side effects. So since it is beta plus alpha adrenergic blocker, it shows alpha adrenergic blocker side effects as well as beta adrenergic blocker side effects. So because of this reason, it is used only in severe hypertension in patients who are not responding to beta blockers. So this is about beta plus alpha adrenergic blockers. Now we will look at the next class of sympathetic inhibitors. They are alpha adrenergic blockers. So we will look at this class of drugs by taking prazosin as an example. So prazosin is highly alpha-1 selective agent. So its selectivity, when we see the ratio of its selectivity, the ratio of alpha-1 to alpha-2 selectivity is 1000:1. So it is 1000 times more selective to alpha-1 than what it is to alpha-2. So it blocks all the subtypes of alpha-1. Alpha-1 has different subtypes. So it blocks all the subtypes of alpha-1 equally. So when it comes to alpha-1 plus alpha-2, it is 1000 times more selective to alpha-1. But when it comes to subtypes of alpha-1, it equally acts on all the alpha-1 subtypes. Coming to mechanism of action, when alpha-1 receptors are present postsynaptically. So when these receptors are stimulated, norepinephrine and epinephrine cause vasoconstriction. constriction, and because of vasoconstriction, blood pressure is increased. So the action of these the function of these alpha adrenergic blockers is to block this cycle. So what they do, they inhibit this alpha-1 receptors, they block alpha-1 receptors, because of which this vasoconstriction effect of epinephrine and norepinephrine is inhibited, because of which vasoconstriction, that is constriction of blood vessels, does not happen. So when this happens, dilation of blood vessels happen, because of which the blood pressure is reduced. Coming to the adverse effects, the adverse effects of prazosin are less marked. So some of those adverse effects are postural hypotension. So this happens when the drug is started initially. In the initial stages, what happens? The patient experiences dizziness, fainting, etc. So this is called the first dose effect. So to avoid this first dose effect, the patient should start this drug at a low dose or at a lesser dose, or the patient should be given prazosin initially, at least for the bedtime. So postural hypotension, it occurs in the initial stages, which causes dizziness and fainting, which is called first dose effect. And in order to avoid this first dose effect, we have to start the treatment with prazosin at a lower dose, or it should be given at bedtime. The other effects of alpha blocking actions. So because of alpha blocking, there are certain effects which happen. They are also milder, like meiosis, nose stuffiness, etc. These adverse effects are also milder. So coming to the next class of sympathetic inhibitors, they are central sympatholytics. So by the name itself, we understand that they act on brain. So central refers to their action on brain. So taking clonidine as an example, we will look at how these drugs act. So coming to clonidine, it is a partial agonist with high affinity and high intrinsic activity at alpha-2 receptors, especially alpha-2A subtype of these receptors present in brainstem, and it is a moderately potent antihypertensive agent. So coming to their mechanism of action, so we see that it acts mainly on the alpha-2A subtype receptors present in brainstem. So we will look at how it acts. So stimulation of alpha-2A receptors present mainly in postjunctional medulla, that is vasomotor center, results in reduced sympathetic outflow. So when the sympathetic outflow is reduced, blood pressure is also reduced, and another effect which is seen is reduction in heart rate, that is bradycardia, and plasma noradrenaline levels are also reduced. So its stimulation of alpha-2 receptors which are present postjunctionally in medulla, that is vasomotor center, results in reduced sympathetic outflow, which results in fall in blood pressure and bradycardia. Coming to interactions, the two drugs are mainly seen, that is tricyclic antidepressants and chlorpromazine. These two drugs, when given, they abolish the antihypertensive action of clonidine, because of which these combinations should not be given together. This action is probably because of blocking of alpha receptors on which clonidine acts. Coming to the adverse effects, since it acts on brain, we can see certain CNS adverse effects and also certain anti-secretory actions because of clonidine. So the adverse effects seen in clonidine are quite common. They are sedation, mental depression and disturbed sleep, dryness of mouth, nose and eyes, constipation. So these two adverse effects we see are because of its anti-secretory effect. So central action of clonidine produces anti-secretory effect, which results in dryness of mouth, nose and eyes and constipation. And the other adverse effects are impotence, salt and water retention, bradycardia as we have seen here, postural hypotension which is mostly asymptomatic. One of the major adverse effects of clonidine is it causes an alarmingly increased blood pressure in patients who suddenly the dose for 1 to 2 days. So if a patient misses dose for 1 to 2 days, it causes an alarming increase in blood pressure, which results in tachycardia, restlessness, anxiety, sweating, headache, nausea and vomiting. So because of this, these drugs should not be missed. So the dose should not be missed when in patients who are taking these drugs. So when this happens, this can be treated by using a combination of alpha and beta blockers or a potent vasodilator like sodium nitroprusside, or clonidine itself can be used. So this is about the pharmacology of central sympatholytics, that is clonidine. Hope you all understood. Thank you.